Welcome to another episode from the Veterinary Research Channel. Today we are diving deep into a recent study that offers a glimmer of hope for dogs battling relapsed lymphoma. Understanding canine lymphoma and the challenge of relapse. Canine lymphoma, particularly the multicentric type, is a cancer that initially responds well to multi-agent chemotherapy. The usual protocol, which includes vincristine, cyclophosphamide, doxorubicin, and prednisone, often results in remission. Unfortunately, this remission is often short-lived, with relapse occurring within the first year of treatment. When lymphoma returns, it's more difficult to treat. While second remissions can be achieved with rescue chemotherapy, they are generally not as effective or long-lasting as the initial response. This is why there is a continued need for investigation into novel protocols. Combination chemotherapy is often considered more effective than single-agent protocols for treating lymphoma. Combining drugs can target cancer cells through multiple mechanisms, reducing the chance of the cancer becoming resistant to the drugs. Ideally, these multi-agent protocols should combine drugs that are individually effective and have minimal overlapping toxicities. The MOC protocol, a novel approach. The study we're discussing today focuses on a novel drug combination called MOC, which stands for Melphalan, Vincristine, and Cytarabine. Researchers at Oregon State University and The Ohio State University evaluated the tolerability and efficacy of MOC in dogs with relapsed multicentric lymphoma. How MOC works. Each drug in the MOC protocol has a distinct mechanism of action. 1. Vincristine. This is an anti-microtubule agent. It binds to tubulin, which inhibits microtubule assembly. This disrupts cell division and leads to cell death. 2. Melphalan. This is a cell cycle nonspecific alkylating agent. It belongs to the nitrogen mustard subclass and damages DNA, preventing cancer cells from replicating. 3. Cytarabine. This is an antimetabolite. It mimics deoxycytidine and interferes with DNA synthesis. It inhibits DNA polymerase, which is needed for DNA replication, leading to cell death during the S phase of the cell cycle. The study design. The researchers conducted a retrospective evaluation of dogs treated with MOC at Oregon State University between March 2013 and March 2020. To be included in the study, dogs had to have a confirmed diagnosis of high-grade or large-cell lymphoma, have previously been treated with chemotherapy, and have measurable disease at the start of MOC treatment. The data collected included patient information, clinical stage, previous treatments, response to those treatments, date of relapse, the number of MOC cycles received, any adverse events, date of disease progression after MOC, subsequent treatments, and the final outcome. The response to therapy was evaluated through physical examinations. The criteria set by the Veterinary Cooperative Oncology Group were used to assess the outcome. A complete response meant all measurable lymph node enlargement had resolved. A partial response was a reduction of at least 30% in the size of the lymph nodes. Stable disease was defined as less than a 30% reduction or less than a 20% increase in lymph node size. Progressive disease was defined as more than a 20% increase in lymph node size. The MOC treatment protocol. In the MOC protocol, dogs received vincristine and cytarabine on day 1. Vincristine was administered intravenously, and cytarabine was given either as an intravenous infusion over 4 to 6 hours or subcutaneously over 2 days. On day 7, dogs received Melphalan orally. The cycle was repeated every 2 weeks for a minimum of 3 cycles, or until the treatment failed. The order of treatment could be altered depending on the veterinarian's or owner's preference. Some dogs also received a steroid, such as prednisone or dexamethasone, depending on the veterinarian's preference. Antiemetics and antidiarrheals were often prescribed to prevent or treat side effects. Key findings: tolerability. The study found that the MOC protocol was generally well tolerated by dogs. All dogs experienced adverse events, but the majority were mild and did not require hospitalization. The most common adverse events were anemia, neutropenia, and diarrhea. Anemia, a lower than normal red blood cell count, was more frequent than expected. While myelosuppression, the suppression of bone marrow activity, is a known side effect of chemotherapy, anemia is less common because red blood cells have a longer lifespan than platelets or neutrophils. It is possible that undocumented bone marrow involvement or cumulative bone marrow suppression from prior chemotherapies contributed to the frequency of anemia. Neutropenia, a decrease in neutrophils, a type of white blood cell, was less frequent and severe in this study compared to other studies. Dose delays were uncommon, and the dose of Vincristine was often increased in subsequent cycles. Diarrhea and lethargy were also observed. Gastrointestinal toxicity was relatively uncommon. However, in 2 cases, the MOC protocol was stopped due to adverse events and a perceived decrease in the dog's quality of life. Balancing chemotherapy toxicity, tumor response, and patient quality of life is always a challenge. Key findings: efficacy. The overall response rate to MOC was 38%. This included 19% of dogs achieving a complete response, meaning the disappearance of all measurable signs of lymphoma, and 19% achieving a partial response, meaning a significant reduction in tumor size. An additional 27% of dogs experienced stable disease, with a lymphoma did not worsen. Overall, 65% of dogs experienced clinical benefit, defined as complete response, partial response, or stable disease. The median progression-free survival, which is the time from the start of treatment until the disease progresses, was 29 days. However, dogs that experienced a response to MOC had a significantly longer progression-free survival compared to those who did not. Interpreting the results, the researchers concluded that MOC is a safe treatment option for relapsed lymphoma in dogs. The adverse events were generally mild and manageable. The overall response rate was comparable to other second-line rescue protocols. The clinical benefit observed in the majority of dogs suggests that MOC can provide meaningful improvement in quality of life, even if a cure is not always possible. Important considerations and limitations. It's important to acknowledge the limitations of this study. The study was retrospective, meaning it looked back at data that had already been collected. This can introduce biases. The sample size was relatively small, and the patient population was heterogeneous, meaning there was variability in the types of lymphoma and prior treatments. There were variabilities in drug dosages, order of treatment, and route of drug administration. For example, Cytarabine was given either intravenously or subcutaneously, depending on clinician and owner preference. The significance of the study. Despite these limitations, this study provides valuable insights into the use of MOC for relapsed canine lymphoma. It suggests that MOC is a well-tolerated option that can provide clinical benefit for many dogs. Further studies are needed to confirm these findings in a larger, more controlled setting and to optimize the dosing and administration of MOC. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.